I'm Cecile Edwards, as I said, the Senior Manager of the New Jersey Birth Equity Funders Alliance, and I'm here with my colleague, Karen, who is the Assistant Project Manager for the Funders Alliance as well. And the Alliance is a coalition of funders who came together in the spirit of collective action to work towards birth equity in the state of New Jersey. And we support the Nurture New Jersey plan in their effort to make New Jersey one of the safest places to give birth in the U.S. The Funders Alliance started in 2021. And one of our first charges was to create a community advisory committee to steward an initial $500,000 fund to distribute to community-based organizations that would, next slide, please. That would distribute funds to community-based organizations, smaller community-based organizations that would not typically receive funds. So our first round RFP, we issued the RFP for organizations that were $250,000 and below. This one, we slightly elevated it to $500,000 and below. So our organizations, again, are typically organizations that are smaller organizations that are Black and Latinx led. So understanding the racial disparities in birth outcomes in New Jersey and the ranking that New Jersey is in, our initial funders came together, and we have recently added 2 new funders of the Bristol Myers Squibb Foundation and Organon. And I did share some about our community advisory committee, and our advisory committee is a team of New Jersey-based maternal health, family wellness experts, birth workers, grassroots leaders that governs this funding. So they assist with creating the grant making. So this grant that we're talking about, they are the individuals who thought, based on what they experienced in their work, that this was a priority. The first priority was around postpartum support, which was a huge success in terms of just receiving applications, and our internal work as the Alliance and the various funders really thinking about and being able to look at postpartum support as a critical area for maternal mortality. So I just wanted to go back a little bit to the question, because I know that we had a question to garner conversation. So I didn't want to jump over that. But you can type in the chat, or you can respond to this. Again, we do have a small group, and if you don't mind being recorded, this recording will be shared publicly. So if you don't mind being recorded, then your response is welcome verbally. But what does building an ecosystem of wellness and birth equity mean to you? What does that mean for you?
I think, honestly, do you mind if I just jump in?
Yeah. Oh, right, please do.
By the time I type it, we'll be here for like another 10 minutes. It's really about making sure that everyone has the ability to access the resources they need on their wellness journey, whatever that may be. And unfortunately, there's so many different challenges along that road, in what we've experienced at our family health center. Sometimes there's fear, sometimes there's embarrassment of asking, even when you are educating some of our patients on resources that are available to them. But really, again, not just for themselves, but for their children and that continuum of care. Mm-hmm. You're pregnant, you're going to have a child, but then what does that mean afterwards too? How do you make that connection, after delivery? Are you going to continue that care? We've seen a lot of our high risk maternal patients, are you going to continue taking your blood pressure, monitoring your blood glucose sugars? Are you going to be connecting to the pediatrician in the clinic for vaccinations for your child? So again, it's really connecting the dots for the patient and their family, making sure that they have everything that they need. And I know I'm a little bit all over the place, but sometimes it's simple things like diapers and wipes. That's something we just had a diaper and wipes drive a couple of months ago internally within the healthcare system, because we've added some staff to support our SDOH efforts. and recognizing there's such a great need. Now we're doing a school drive. It's a little different take, but it's also recognizing with our partners in the community, even financial counseling. How do you, when you go on an interview? So again, what are the things that we can do, not just ourselves, but working with our community partners and really connecting our families to resources that they need.
Yeah, that absolutely. Ngara?
Yeah, I'd add that to what Emily was sharing, that doing that in a way, what she just described, where people have to do less, if you will, at least in this moment in time. So during the birth experience, if you will, or the pregnancy experience, I think there are currently the healthcare system asks a lot of the patients. That's my personal perspective. Whereas a lot of supports do exist in many cases, but people are, either unaware or the solution isn't built in a way that ensures that people, know it exists or is doing the outreach, has the touch points necessary so that the expecting person knows what exists in their community, in their sphere, through their insurer, what have you, that would benefit them. And even further, I think about when we talk about ecosystem of wellness, Emily just described, families needing Pampers and things of that nature. And it's like, when employment and pay policy work on behalf of families so that they can either afford those things or, are a part of a system that provides it when needed, I think is very helpful. And so when I think about the ecosystem, it means, all the small S systems are working in a way that has appropriate touch points for families, that, as she mentioned, they're getting what they need when they need it, and aren't having to do the extra work of, I gotta go look for it, I have to go look for it. So
I think if I can add to that too, it's also building an awareness even above and beyond the patients. So for example, for us, a big challenge is transportation. So how are our patients getting to the family health center or to the hospital? There's no bus stop within a walking distance or safe walking distance to the family health center. That route actually was discontinued during the height of COVID. So it's, what are we doing and how do we interact with legislators, right? Making them aware, like this is a problem. So it's the piece, but that's part of the ecosystem, right? There are all these different pieces. So, I think that's where it's very complex. The more you start drilling down and the more you talk to the patients and really learning, what their personal situation is and really uncovering so many different things. And it is about connecting, and then sometimes us becoming more self-aware about how we engage with our patients and the families as well.
Yeah, absolutely. Thank you for sharing those very many pieces. And I think that captures the essence of the ways in which the Community Advisory Committee was thinking of just this issue and what they wanted to source from the community, right? How are communities managing these kinds of concerns? Because when you're talking about community health workers, doulas, they're on the front lines with families. And so they hear and may think of projects or want to implement something within their businesses that can assist with this process, but they may not have the capacity, the finances, et cetera. And so I really appreciate the robustness of that conversation. Next slide, please. So with that, I want to go into why the focus on the ecosystem of wellness and birth equity. And again, our Community Advisory Committee identified tackling preventable maternal deaths as a crucial focus area based on their work with communities and their own lived experience. So this idea of education and advocacy and thinking about how to work through these issues. So we know that 91% of New Jersey pregnancy-related deaths between 2016 and 2018 were found to be preventable. And people of color experience bias, prejudice, and discrimination in the healthcare system, which leads to disparities in pregnancy-related deaths. Birth equity community-based organizations in New Jersey, through our research that we conducted last year, identified housing, transportation, language assistance, legal services, disability services, and financial services as high need areas for birthing people, according to our landscape study. And so again, this brings it full circle that the priorities for the funding of this would be programs and initiatives that provide maternal health education to Black and Latinx families, such as lactation education, education on preeclampsia and other high-risk factors. These are just examples. There's plenty others. Culturally congruent prenatal pregnancy and postpartum maternal mental health support, because we know that mental health is not something that's often discussed in Black and Latinx communities, and certainly not dealt with in a holistic way for families to receive care. So trauma-informed initiatives, in-home mental health services with trusted providers, and other healing practices such as music therapy, movement classes, etc. Programs and services addressing the social determinants of health, including but not limited to transportation, foods, access, and housing, and programs and services that educate and provide support for fathers and partners supporting birthing people as well, which is something that we often don't think about. I'll make an honorable mention for domestic violence, as well as one of the conversations and concerns that we often don't create or have. But this is something that comes up very often in the conversation around birthing, social determinants of health, I guess you could say, in birthing spaces. So just very briefly, this is our application deadline, is August 31st. Our applications are intentionally curated to be simpler for community-based smaller community-based organizations, because we do operate through the lens of trust-based philanthropy and particularly grant making. Our grantee notification would occur sometime in September, late September, and grant dispersal in 2023, October of 2023. So who is eligible? So registered 501c3s and businesses. So if you are a registered business, you can actually apply for this grant. Your annual operating budget of your entire organization needs to be $500,000 or less in the fiscal year 2022. If you are a business in service for at least or for less than 12 months from the application due date, you can apply, but you would need a fiscal sponsor. If you have been in operation for over 12 months, then you can apply as an individual, LLC, S Corp, C Corp, whatever it is your business structure is. Applicants must also be rooted in their communities and respond to the community's needs, strengths, knowledge, and values and practices. And applicants do not need to have experience in birthing and birth equity, but their work should address social determinants of health and strongly align with the values of birth and racial justice. And the funds must be used to support the funding priorities. So I'll stop there. Yep, I'll stop there and see if there's any questions, because there would be.
Obviously, the hospital's operating budget is well above 500,000. So it's really looking at the entire organization, not department or like program specific, if we're looking at clinic services or anything like that.
Yes, at this time we have to, and this has to do with back end stuff, but yes, at this time, it has to be of the entire organization, because again, we are really trying to target smaller organizations and those who would typically, again, not receive funding from anywhere, let alone. So most of our in our first round, most of our individuals that received the grant had never received a grant before.
Okay.
Yeah, of any kind. So
that disqualifies us clearly.
yes, but you work with a lot of community partners that may qualify. So
yeah, so I was gonna say, are you okay with me staying on? Because we do work with a lot of different groups, like Healthier Middlesex and things of that sort. So I feel like maybe this is something I can bring to them and or another organization, and maybe they can be the lead and we'll work together.
Absolutely. I mean, if they receive the grant and they decide to work with the hospital in some way.
Okay.
That's you know, as long as they are the ones, they're stewarding the funds and they're utilizing it for their, an operation within their business.
Absolutely. Okay.
So the priority applicants are Black and Latina entities or people, and the organization and people that are based and serving residents in the 52 high need municipalities listed in the RFP overview document. So there's a list of municipalities, and we got that from CDC website designation. And so those are the areas of high need in the state of New Jersey. So the application components for 501c3 organizations that are mandatory are the application form, of course, that include basic organization and leader demographics, such as the name, the website, operating size, financials, mission, program details, and intended impact. Testimonials, yes, testimonials are utilized, and testimonials can be anything from having some text messages from, you know, someone who you served, to an email from someone that you serve saying, hey, your services really helped me in XYZ way, and thank you. And a proposed budget that aligns with the project or program that it needs and goals that you are presenting. You have an optional ability to also share a video or audio recording of the application form information. And just to note that the evaluation will be based on the content, not the quality of the video or sound and editing. So if you do a voice recording, you know, and your baby is in the background, that's fine. You'll be okay with that. But it has to be a maximum of 2 minutes, and there is a way to upload that. And any other supporting documents that you feel would, you know, just show some of your work, or you are more than welcome to add that as well to the applications for 501c3 organizations. For businesses, a lot of the same. The other mandatory pieces, though, are the profit and loss statement for the most recent 12-month period, or 1 to 2 years of audited financial statements from a CPA, et cetera. Evidence of legal status of the organization. So some of those examples would be articles of incorporation, tax classification. So when you register a business in the state of New Jersey, they send you forms stating that you have been registered in the state of New Jersey. And so that's something that's usually pretty easy to acquire or have. Or an annual report is another example. If your business is more than a year, then you would have filed an annual report. And a brief description of the organization's history, goals, mission, recent activities, and future plans, and a list of the organization's governing body and key leadership. Optional need is evidence of previous grants, but that's optional, so you would not have to provide that if you do not have that as a business. So we are going to go a little bit into, and I feel like I'm moving a little fast. So if you want me to slow down, or you have a question, please feel free to just pop something in the chat, or just say, hey, I have a question. So the profit and loss statement is something that is required for businesses to have. And so, first of all, this is our first time giving to business. Typically, organizations do not provide funding to businesses, but this is something that was very important to me as someone who is a social entrepreneur myself, understanding the work that goes into it. That funding can and should be also extended to these businesses that are also providing important services in their communities. And so in the profit and loss statement, it can be a very simple profit and loss. Some are very complex, some are very simple. The example that we give within the application is a pretty simple one, and it just has income and revenue, expenses, costs of goods sold, net income. And so this is an example of that. And so as you can see at the top left, you can put the business name, you can put the financial year beginning, so it would be January 2022, or now we're in August of 2023. So if you want to put from August of 2022 to August of 2023, that is actually 1 year before, so that would be the dates that you would need to put. And then provide some, the sources of revenue. So if you get sources of revenue from your doula work, how much money did you make per month? If you also sell classes, then the source 2 would be classes, and how much did you make per month? And you can add, the other details if you desire there, and it'll tell us the gross revenue for that year. And then you have other operating costs and expenses below, and it's a active sheet. So it will calculate what your losses are, your profits or losses are for the month and for the full year on its own. And so try to keep it very simple. You do not have to use all of the, lines. Something doesn't have to be in all of the lines if it is not relevant to you. So you may not have purchased something for resale, for example. The point of this is really to be able to show the ability to manage funds. And this is important for our fiscal sponsor, Rockefeller Philanthropic Advisors, because they get audited and they would need to be able to show why they were giving money to this business, as opposed to a 501c3, which is usually the kinds of organizations that they give money to. And this is just great business practice if you're a new business or a newer business to have a profit loss statement. I can say from my own personal experience that knowing what is coming in, what is going out, what I can spend, what I can't, this is a business development point. So if we look at it as that, then I think we have a better relationship with completing such a task as well. But if there are any questions, there will be an email underneath this presentation for those who have any further questions to ask. Next slide, please. So these are, and Corinne, please stop me if you're the one that's supposed to be doing these slides, because I certainly don't recall who's supposed to do which ones. So were you supposed to do this one?
Yeah, I was supposed to do the earlier ones, but I can take over now. Yeah, so the application asks a couple of questions just to get a better understanding of the organization's and the applicant's mission. So the first question is just what motivates your organization to address disparities for Black and Latina birthing people and infants in your communities? And then just asking for any examples if you have prior experience working in the maternal health space. And then just having a better understanding of how the grant funding will actually advance the work that you're doing, addressing disparities for birthing people in your communities. Next, the questions ask, just gather some information about the impact and evaluation of your work, specifically the impacts your organization has had for Black and Latina birthing people. And then as well as any community partners or other organizations that you partner with to carry out your mission. And lastly, this is a newer addition to the RFQ from last year. What do you hope to achieve with the funds? Applicants should identify different metrics that they want to track, such as providing transportation for a certain number of families, or providing services for a certain number of clients. And as Cecile mentioned, the applications are due August 31st. After that deadline, the Community Advisory Committee and some of the funders of the Alliance will go through an evaluation process. If you look at the RFQ, the RFP online, you can access the evaluation rubric that the CAC will use to actually review all the applications. And so for reporting, grantees are actually awarded funds. There are a couple of reporting requirements that you have, including a midterm check-in, which can be done over the phone or in person, a post-grant report, and then an updated budget, and a profit loss statement, which is only for businesses who are applying for funding.
And I'll add that if you go back to the previous page, that the updated budget, for those who receive the grants, we would provide an example of how you can do that updated budget so that, you know, it's just clear. And we have an example of what the budget looks like actually in the RFP as well. So, yeah. So this, you know, I think this RFP really is it has a wider selection of things that people can consider when applying to show that they are providing an ecosystem of wellness, or in the ecosystem of wellness, providing a service in there. And so, you know, that may be a little bit, you know, hopefully clear for individuals to see and understand themselves, or see themselves in this process. So this is a time for questions. If anyone has any further questions, comments, concerns, we're open to hearing them all. And, you know, any just thoughts that you have in general.
I have a quick question. When we were just brainstorming with our SBOH team, you know, some of the things they brought up were, would the grant, and I know we can't apply for it, but would the grant, you know, be able to fund things like diapers and wipes or formula, things of that sort?
Yeah, I mean, again, it's just really trying to showing that this is that this matches the priority or meets the priority.
Okay.
I would say that if you are to be interested in applying for something like that, I would be curious to think about how to make this a part of a sustainable practice in the ecosystem of birth equity. So, you know, not just providing diapers one time, but, you know, are we advocating for, you know, the government to provide $100 a month? I don't know what diapers cost anymore because my daughter is 15, but provide, you know, $100 a month to ensure that families can afford diapers, for example.
Okay.
I would say that would, I think, be because we're really, or how do you partner with already existing programs to ensure that families get, you know, what they need? I think that this is more so the thought process around considering an ecosystem.
Okay. That's what I thought. Thank you.
Of course. Any other thoughts or questions about anything? And please, thank you for sharing this with, you know, individuals and businesses and organizations that do qualify. We look forward to seeing those applications. Another thing that we did not mention is that not only are funds provided, but technical assistance is also provided with this. And so our first round of grantees is currently going through their year of technical assistance through our partner, Resilia. And Resilia is a technical assistance technical platform online that individuals can go on, 501c3s, businesses that specifically cater to Black and Latina BIPOC businesses and 501c3s to provide them with the assistance that they need to develop their enterprise. And so that is something that we will continue to do, is to provide that technical assistance to any of our grantees as well.
If we have any questions, it might be in the material that was online. Like just general questions regarding the application.
Yep, I just posted Cecile and our both of our email addresses. So if there are any questions, feel free to reach out to us.
Okay.
Yeah, I think the NJ at Birth Equity Alliance is the one that's also on the RFP.
Yeah.
Any of those are fine and it works.
Thank you.
Of course.
That's all for me. No other questions on my end.
Wingora, did you have anything? If you, I want to make sure that you.
I didn't, and I was attempting to stay on mute because I'm in the car, so I didn't want you to hear too much background noise. But I was
saying in my head, I'm so glad that you all are taking this community-based approach. And for me, I really wanted to listen in just to hear what foundations and the people supporting their work are doing in communities and potential for a partnership. And so thank you for outlining all of this. And I plan to just, stay informed of what this particular initiative accomplishes.
Thank you. Thank you. I appreciate you
Yeah,
making the connection. And again, our emails are there. So if you want to reach out to have a conversation, then feel free.
absolutely.
Mhm.
Perfect. Thank you so much.
Thank you. It's a pleasure. I guess we'll have some of our time back, which is always a blessing. So thank you all so much for joining. It's such a pleasure to meet you both. And looking forward to connecting.
Thank you.
Thank you, everyone.
Bye-bye.
Thank you.